Respiratory system. Chapter 30. The respiratory system. A. Cold. Cold is a common symptom of upper respiratory tract infection, URTI, and lung disease. A cold may be productive where the patient coughs up sputum or non-productive. Where there is no sputum, a productive cough is often described as loose and non-productive cough a dry. Sputum of phlegm may be clear or white, mucoid, yellow due to the presence of pus, purulent, or blood stain, as in hemoptysis. A doctor is examining a patient who is complaining of a cold. Doctor: how long have you had the cold? Mr. Milton: oh, 4 years. Doctor: do you smoke? Mr. Hamilton: I used to smoke heavily, but I gave up a year ago. Doctor: do you cough up any phlegm? Mr. Milton: yes. Doctor: what color is it? Mr. Hamilton: usually yellow. Doctor: have you ever noticed any blood in it? Mr. Hamilton: no. Doctor: any problems with your breathing? Mr. Hamilton: yes, I get very short of breath. I have to stop halfway up the stairs to get my breath back. The doctor writes in the patient's case notes: CO, dyspnea, and cough, purulent sputum 4 years, no hemoptysis. Note: the noun phlegm is pronounced phlegm. Auscultation. The doctor is examining Mr. Hamilton's chest. Take deep breath in and out through your mouth. Good. Now say 99. Listen to the chest with a stethoscope. Reveal the presence of sounds. Apart from the normal breath sounds. There are two main kinds of that sounds: crackles, which sound like hairs being rubbed together, and suggest the presence of fluid in the lungs. Wheezes, which are more musical sounds, like whistling, and indicate narrowing of the airways. The sound of asthma a patient's breathing is also called wheeze. The sound heard when the pleural surface are inflamed, as in pleurisy, plural, is called a plural group. The doctor asked Mr. Hamilton to say 99 to check vocal resonance, which may be increased as in pneumonia or decreased as in pneumothorax. After examining Mr. Hamilton, the doctor adds to his notes, "O E chest, early inspiratory crackles, both lungs base, more expiratory wheeze."